Hi, ma'am. How are you?
Good, good.
Okay, so I'm Dr. Shubhiaggarwal, and today we have ourselves with Dr. Shubha Sinha. She is a consultant breast and oncosurgeon at Apollo CBCC Ahmedabad. So, with the help of Dr. Shubha, we are trying to create awareness so as to decrease the incidence of breast cancer. It is ranked as number one in Indian females. So, ma'am, before going to any questions, could you please explain us what is exactly breast cancer?
Okay. Yeah. So, first of all, we need to understand what is cancer. So,
Yes.
whenever normal cell of the body it undergoes any mutation, that means if it undergoes any bad change, and it keeps on dividing without any interruption, then it is cancer. The cell mass which forms, it is cancer. It can happen anywhere in the body, in any organ, in bloods, anywhere. When this thing happens in breast, then it is called as breast cancer, which is a really wide term because any cancer in breast is called as breast cancer, but breast cancer has got multiple types according to which patient's treatment is decided. So
Yes.
many a times this is a very big confusion in patients. What they come and they tell us, I also have breast cancer, the patient whom I met outside also has breast cancer. You have offered them surgery, you have not offered me surgery. Why is it so? So basically, breast cancer is a wide term which specifies that okay, there is a cancerous growth, there's a cancerous tumor in the breast. But then all cancers are of different types and all treatment is tailor-made according to that patient's cancer. So the first thing, never ever compare your disease with anybody else's.
Yes, exactly. So, ma'am, shall we go on to the questions?
Yeah, sure.
Okay, so the first question is if I have a lump in breast, is it definitely cancer?
Most of the people do have something or the other in breast. If 8 out of 10 cases, those lumps are benign lumps, that is, they are not cancerous. Only 2 people would have cancer. But if there is any lump or any change in your breast, you should immediately go to the doctor. Because if you are in one of those 2 cases who could have cancer, in breast cancer, the treatment depends upon early diagnosis. The earlier you
Yes,
get diagnosed, the chances of your survival increases.
yes.
So any change, just go to the doctor, but it does not mean that if you have a lump, you have cancer. No. Most probably it is a benign disease. So no need to worry. Don't stress, but go and meet the doctor. Initially, you can meet anybody. You can meet your general physician, you can meet your gynecologist, you could meet your family doctor, and then go on accordingly. So most of the people, they keep on stressing at home and they don't come to the doctor, which is the
Yes.
wrong thing. Most probably it is nothing to worry about. What you're thinking that it is lump, it may not be a lump also. Even if
Yes.
it is lump, most probably it's a benign lump. But if it is cancer, the thing is that you should treat it early.
Ma'am, there's a taboo in India as to, the early we go to the doctor, people don't accept that कि छोटी सी बीमारी के लिए डॉक्टर के पास क्या जाना. So
Exactly.
they
So
tend to ignore that.
basically all females, they ignore everything.
Exactly.
So if we have educated females coming to us with 20 centimeter lump in breast and are asking why you did not come, their answer is now I came because I was not able to wear my clothes.
Yes.
So, and this is the answer given by educated females. So, and most of our population is not educated.
And
So
ma'am,
how are we?
so
Yes.
you were saying something.
No, no, go on, carry on.
I was saying that ample amount of information is given on the internet. Still,
Yes.
the ignorant nature is, not coming on the track.
Maybe with the population we have, maybe we need to do more in terms of spreading awareness. Most of our population is not internet literate. So,
Yes.
yeah, so we do need to do something. We do take awareness programs for those who cannot, like we go to rural areas and
Yeah.
make people aware, which has considerably decreased in the last 2 years, of course, because of
Um,
COVID situation. But still, base what we have seen is if you're going to a rural area and educating those people, we get a very good response. The
okay.
response, non-responses are those who are in urban places who are really educated. So the
Okay.
problem is those people more. See, if you don't know about anything and if you are coming late, we cannot blame you.
Hmm.
But if you know everything, you've got all the resources in hand, and still you're coming late, then that is
Hmm.
not acceptable at all.
Yes. So, ma'am, the next question is using deodorants harmful? Can it cause cancer?
This is the most common urban legend.
Yes.
You will get WhatsApp messages, you will get emails, you will also get those news letters and emails telling you don't use deodorants, don't use antiperspirants, and they'll write down a detailed note that if you use deodorant, you're blocking that pore, which in turn leads to axillary swelling, which causes breast cancer. It is all false. It is the biggest myth. If your deodorant or antiperspirant or perfume is FDA approved, there is no problem at all. There is no direct link to breast cancer. So no, it
Okay.
doesn't cause breast cancer. No.
Okay. And does any injury to breast cause breast cancer?
Okay. So most often what happens is that most of the people don't do self breast examination, which
Hmm.
each and every female should start doing it once they start their periods or at least after 20 years of age. Nobody
Yes.
touches their breast regularly. What happens is that you get some injury on breast, and at that time you're touching your breast, at that time you're palpating and you see that there is some
Yes.
mass or there is some change, and then you go to the doctor. So what happens that indirectly you link that because of that injury I
Oh,
had this lump and
lump.
now that has become cancer. So
Yes.
most of the cancer patients will come and tell me that I got an injury few days back because of that. This lump is there. So see, and then on biopsy, when it will turn out to be cancer, they'll say, yeah, I had cancer because I had injury, and then they will
Okay.
say this to their relatives, their friends, everybody. So now the belief would be any injury to breast leads to cancer. That is
To
not
cancer.
so. No injury to breast leads to cancer.
So basically, self-examination is the key in breast
It
cancer.
is must. Yes.
Yes. Okay. And is having breast cancer a death sentence?
Not at all. As we say, early diagnosis will save you. Early diagnosis saves lives. Breast cancer, if somebody needs to have cancer, if somebody has to have cancer, breast cancer is the best cancer to have. But you have to come early to the hospital. The earlier you come, your chances of survival increases. If
Increases.
somebody gets diagnosed in stage 0, that is the precancerous stage, which is only diagnosed by screening mammography, if somebody comes at that stage, then your survival is almost 100%, 5-year survival. We don't say 100, we say 99%, but those 1% deaths which have happened due to other causes. So stage
Okay.
0, 100% survival. So the earlier you come, better the prognosis. So no, breast cancer is not a death sentence, not at all. It's absolutely curable, provided you come early to the hospital and don't ignore yourself.
Ma'am, recently I came across two, three cases. Like I told them to self-examine their breast, and they were like, "Ki, we don't have a family history, so how would we get cancer?" And
Hmm.
I
Yes,
couldn't ex
yeah. This is also one of the most common misconception. So many a times patients come with a really large lump. And when we ask them that you are educated,
Yes,
like you know everything about breast cancer, you know you should self-examine, you are doing also, then why did you come late? Because I don't have any family history, I won't get breast cancer. So I thought this was a
exactly.
benign disease. So I did not come. But only most of the cases, 9 out of 10 cases who come to us have no family history. Of
Okay.
course, if you have family history of breast cancer, your chances of getting breast cancer increases from the population who does not have. But it does not mean that if there's no family history, you cannot get breast cancer.
Breast
No, most of
cancer.
the patients who come to our OPD, they don't have any
Have a
family
family
history.
history.
Most.
Exactly.
So no, it's not that if you don't have a family history, you won't get breast cancer. No, it's not that.
Okay. And ma'am, does wearing underwired bra causes breast cancer?
Okay, so earlier it was thought by general population that wearing underwire bra causes lymphatic obstruction, which in turn
Okay.
causes breast cancer.
Hmm.
But it has been proved that this is all unscientific. It is just a myth. There is no relation between any kind of bra, any color of bra. We get this also many a
Yes.
times, that dark colored bra causes breast cancer.
Yes. Yes.
Wearing a bra causes breast cancer. This also we get. So, yeah. So
Ma'am,
there is
I have
no.
got cases where someone says that not wearing a bra causes breast cancer.
Yeah, exactly. So
Eh,
there is no relation. Even if you wear a bra or you don't wear a bra, it has got no relation with breast cancer, type of bra, color of bra, wearing or not wearing a bra. Actually, I think last year or something, there was a campaign going on somewhere on a radio where
Okay.
a lady came and she started telling that bra, you should not wear bra. It's only because of these marketing that people are wearing bra, and bra causes
Okay.
breast cancer. God has made something which should be free. People are wearing bra. That is why breast cancer rates are increasing. And this was going on radio, on FM.
Okay.
So this is all wrong. There is no relationship between bra and breast cancer. If you want to wear it, wear it. Don't want to wear it, don't wear it.
Right.
If you want to wear any particular kind, please wear it. Don't want to wear, don't wear any color, whatever, wear or not wear, not related to breast cancer.
Okay. And ma'am, what about men? Can they get breast cancer?
Yes, even men can get breast cancer, though very rare. The incidence is only 1%, but men can also get breast cancer. The biggest risk factor is female herself, gender. Female
Yes.
have got the largest risk of getting breast cancer. But that does not mean that men should not be aware. Self breast examination, which should be done every month, is for both female
Yes.
as well as male.
Male.
In males, if they see any lump, they should immediately go to the doctor, because in males the breast cancer spreads really fast because the amount
Yeah.
of breast tissue is less. So it spreads really fast. So men should also not ignore. And yes, men also get breast cancer, though very rare.
Okay. And ma'am, gynecomastia is also associated with breast cancers many a times in males.
Not There is no direct link, but
Yeah.
most of the time they think that it is gynecomastia, and inside there's a small lump, there's a cancerous tumor. So they keep on ignoring it. That no, I have. So whenever they feel that there is anything different, that is why the self breast examination comes into play. If you
Okay.
are examining your breast every month, if there is even slight change, you would immediately go to the doctor. When you're going to the doctor, they are touching you for the first time, but you are the one who are touching yourself every month. So you would be able to differentiate what is not right in your breast earlier than what your some person who's touching you for the first time would do.
Okay.
So self breast examination for both the genders.
Yes. Ma'am, can you tell the exact way and the best way to self-examine your breast?
Okay. So, how you examine it in three positions. One, standing in front
Yes.
of the mirror, one, lying down on the bed, and one, while taking a shower. So, first of all, you have to look while standing in front of the mirror. Undress yourself and look at the mirror. Are both the breasts, nipples at same place? Are there any skin changes? Are there any visible lumps or bumps? Is the nipple normal? Has any nipple gone inside? This you are observing with both your arms by the side of the body. Then you have to lift both the arms above your head and then see, are there any changes? Can you see the nipple going inside, or can you see a visible lump or any skin change which was not there before? Then you have to put both your hands on your waist and then see for all these changes. Then you have to palpate with your hand, and you have to use these three fingers, but never hold the breast. If you hold the breast, you will catch hold of the
Yeah.
glandular tissue, which can be confused with a mass. So you
As a
just
lump.
have to
Hmm.
palpate by pressing. Yeah. So with these finger pads, not the tips, with these finger pads, you just have to palpate gently. And the areas which you should do is right from below your collarbone, whole of the breast. Go systematically so that you don't miss it. Either you go all around the nipple areola complex, or you go from up to down and see whole of the breast. Don't miss the underarm area. Don't miss the area below the breast.
Hmm.
Press the nipple only once and see if anything is coming out, any discharge or anything. Same thing, now you have to do it lying down position. Of course, you cannot see, but you can palpate. And same thing when you are having a shower with soap applied to your hand. Because many times the lump, when there is soap in your hand, it slips and you're better able to realize that there's a lump inside. So these three positions, it hardly takes 5 minutes.
Yeah.
Those who get their periods should examine their breast on fifth or sixth day of their period every month.
Okay.
Those who have stopped their periods, they have to fix any one day, like first Monday of the month or first of the month, and do it. But you should do it every month.
Okay. And ma'am, any other insights that you would like to give us?
Self breast examination every month. Early detection saves lives. So
Yes.
you don't be scared of breast cancer. Even if somebody has to get breast, see, you cannot prevent it. But what
Yes.
you can do is that you can detect early and your treatment should be started early. So don't be scared, but do be aware. And each and every female should be breast aware. Everybody should know how breast cancer presents, what are the symptoms of breast cancer, and when you should consult the doctor. See,
Yes.
first few times when somebody is doing self breast examination, at that time they may have doubt. Anything they're feeling, they'll think that, oh, it is suspicious, we should go to the doctor. Go. There is no harm. Everything is normal. Go. Understand that what you have is
Hmm.
your normal. Everybody's
Hmm.
breast is different. My normal may not be your normal. So, first you know your normal breast and then you go accordingly. If you're not understanding anything, go to your healthcare provider, go to your family doctor, go to a breast surgeon and ask, is this normal? If it is normal, then you know what is your normal and then you have to do it every month. So, self breast examination and early detection. And all female at the age of 40 should at least get one mammogram done, at least one at the age of 40 years.
Yes.
No need for
And
am
ma'am,
I audible?
is ma'am, yeah, there was some problem in the network.
Uh, I cannot hear you actually.
Hello. Can you hear me,
I,
ma'am?